Hi, I'm Emma.
And I'm Helena, and we both work here at the MS Trust. Just as a little disclaimer, we're recording this over Zoom because of coronavirus and social distancing, and also because I got a stinking cold today, so I don't think Emma would like to be in the same room as me anyway. But apologies if it sounds iffy at any stage. Please do bear with us.
We'd like to welcome you to our podcast, Multiple Sclerosis, Breaking It Down, where today we'll be talking about MS relapses.
And for many people with MS, relapses are a big part of the condition. And today we're going to discuss what relapses are, how to recognize if you're having a relapse, and how to deal with them.
We're also going to be chatting with Simon from our Enquiry Line about relapses and asking him some of the most common questions we get asked here at the MS Trust.
And there is a lot of confusion with what is a relapse, and we'll talk more about that with our experts. But I wanted to read this out from our website. A relapse is a relatively sudden, over hours or days, episode of new symptoms or worsening of existing MS symptoms. People call relapses by different names, including an attack, a flare-up, an episode, a blip, or an excavation.
If you have relapsed and remitted MS, you may have relapses that occur for a period of time, which then improve either partially or completely, which is known as remission. They tend to happen most often in the first few years after being diagnosed with MS, but people can experience a relapse at any time. If you've got secondary progressive or primary progressive MS, you may also experience relapses, but they'll happen much less frequently.
As we already mentioned, it can be sometimes not always clear what is a relapse. It's just a flare-up of existing symptoms. We're going to have a listen to Miranda Olding, who is an MS nurse from one of our Ask the Expert videos next, to hear a bit more about what a relapse is and how they're treated.
My name is Miranda Olding. I'm the clinical nurse specialist at the MS Therapy Centre, Bedston North Hants.
How is a relapse defined?
A relapse is defined by new symptoms or the occurrence of symptoms that you've had before, but not for the past 30 days, that last for at least 24 hours and are not being caused by an underlying infection or by heat, or just by becoming incredibly tired. So they have to last at least 24 hours. In fact, they often last a lot longer and are not being caused by infection.
So what's happening in my body when I'm having a relapse?
Cells from the immune system, so the brain has a good blood supply, obviously everywhere in our body has a blood supply, but there are immune cells circulating within our blood which are not supposed to cross the blood-brain barrier, which is a really thin layer of cells, which should be very tightly together in what we call tight junctions. So those cells are not supposed to cross into the central nervous system, the brain and the spinal cord. But we don't know why, but immune cells cross from the blood into the central nervous system. And once they're there, they recognise myelin as a pathogen or an invader, something which is alien, because those cells are actually in an alien environment. They shouldn't be there. So they've become confused. They recognise myelin as alien. Myelin is the fatty covering which acts like a sort of insulating wire along the nerve cell, and they seek to destroy it. The result is that when the myelin has been damaged, the action potential or the electrical signal can't get down the nerve in the way that it should. It's either slowed down or completely stopped from passing, and then you get symptoms in various parts of the body because the nerves can't transmit their information.
Can all relapses be seen on an MRI scan?
A true relapse, a true inflammatory demyelinating episode in the central nervous system should be able to be picked up on MRI. But we know that up to 40% of those can be missed. So they can be missed because the scanners aren't powerful enough. So scanners actually vary in their power and their effectiveness. And also, you can have clinical symptoms from an incredibly tiny little lesion, and those tiny lesions aren't necessarily picked up on scanners. The other problem is that you don't necessarily get your scan immediately that you're having that episode, and actually lesions form, they both form and they heal up. So your body remyelinates in the relapsing remitting stages of MS, and that's putting more myelin down and repairing the damage. And in actual fact, the bright spots only show up when the nerves are in a damaged state. And so if you end up having an MRI 3 months after the event, it may well not show up.
How can you tell the difference between a relapse and day-to-day symptom fluctuations?
It can be a grey area even for your healthcare team. So a relapse, as I say, it would either be new symptoms or it would be old symptoms coming back. We would be expecting that to have some kind of impact on your everyday functioning. So it's very common in MS to have a lot of ups and downs, good days and bad days. And that's because there's a lot of fatigue in MS, and when you're fatigued, it's very difficult to cope, and everybody, feels good sometimes and bad at other times. But also, when your body remyelinates after a really true clinical demyelinating event, it's not quite as strong as the last covering of myelin. So what can happen is that myelin that's there, which has been put on afterwards, is more likely to short circuit under stress. So if your core body temperature is raised for any reason, so it might be because you've just had a really big workout, or it might be because you've just got a really low grade infection, then it becomes more easy to develop symptoms that might be a bit of an Achilles heel for you. So it might be that you get a numb right foot when you're really tired, or if you have a hot bath, or when you've had a workout, or if you run for more than half an hour or something like that. And that's just because that area is an area which struggles when you struggle. And that's not a relapse. If you can have a good night's sleep and then you wake up in the morning and you're okay again, that's not a relapse. Similarly, a lot of people with MS have some symptoms which they have to deal with on an everyday basis, which are always a problem. And so if something's pretty much always a problem, although you might have some days where you feel surprisingly good, that's not a relapse either. It's a kind of sudden event, or it might be an event that starts and then escalates and gets worse, maybe over a couple of weeks, and then kind of plateaus off and then starts gradually to get better.
If symptoms are not caused by a relapse, what could be causing them?
The number one thing is infection. So all of us MS nurses, when someone comes into clinic and says, I think I'm having a relapse, we always say, hold that thought. Do you have any cough? Do you have any cold? Do you have any viruses? Take this pot, let's dipstick your urine, and we need to identify whether there's any hidden infection. If there's hidden infection, yes, the MS will certainly be exacerbated. It can be like a full-blown relapse, but what we need to do is treat the infection, and then everything should go back to normal. Sometimes an infection can act as a trigger for a full-blown relapse, but we have to have completely eliminated any infection before we even consider using steroids or anything like that.
How are relapses treated?
The most common option for treating relapses that need to be treated is using high-dose oral steroids. Having said that, the guidance from the Association of British Neurologists is that steroids should be reserved for the most disabling or the most distressing relapses. Now, how distressing a relapse is really subjective to the person. It depends how frightened they are, how dreadful they're finding everything. Steroids can speed up the recovery from a relapse because they are potent sort of anti-inflammatory in the short term, but they don't have any bearing on the overall outcome. So a relapse will either get completely better or get somewhat better, leaving some residual problems, or not, in its own time. Steroids, some people find steroids absolutely fantastic. They feel brilliant when they're on them. They get the whole house clean, they feel wonderful. Sometimes people really crash afterwards and feel terrible afterwards. Some people feel that the steroids really helped them through and speeded things up more quickly. Some people have a horrible time on steroids and they find they can't sleep at all. It's important that people understand the risks and benefits of steroids. Many people just choose to take some rest and wait it out and try and get better without steroids. And sometimes people choose, yes, do you know what, I want steroids now, and feel that it's really helpful.
How can I manage my anxiety about having a relapse in the future?
I think it's about making sure that you've understood how to identify a relapse. You've understood that whenever you're worried about potentially, are you having a relapse, to immediately get in touch with your your MS healthcare team. If it's more difficult to access your MS team, to get yourself to the GP surgery and just ask the practice nurse to dipstick your urine, so you know all those things to do. If you have people around you who are supportive, to talk with them about, because I have MS, it is possible that I may have a relapse at some time, and it'll probably be, necessary for me to take a couple of weeks off work, and I may need, it's really when life gets more complicated. So when, for instance, you've got young children, that tends to be a time when you really need to call on friends and family, because they're relentless and their demands just don't stop. If you're just living without, perhaps young children, you take the time off work, you can just look after yourself quietly at home and make sure your MS team are aware. But yeah, have those discussions. Think about who could you call on, what would you do? Maybe include those people in those chats. And if you realise that actually you would be in a pickle, then talk to your MS nurse about, what could I do then? Who could I call on at those times? What could we do? So that you've got a plan. Do everything in your power to address the MS. So make sure you are on the most appropriate disease-modifying treatment. And if you are on a disease-modifying treatment but still having relapses, that discussion is had with your neurologist and your MS nurse. Actually, is it time to switch up? Do I need a more effective treatment? Also addressing everything in your lifestyle to reduce inflammation. All the good things about healthy lifestyle. And then not to worry. Because there was a diagram that it says, is there something to worry about? Yes. Is there something I can do about it? Yes, no. If it says yes, yes. Have I done the thing? Yes. Then don't worry.
A big thank you to Miranda Olding at the Beds and Northants MS Therapy Centre for helping us out with this. Now, if this was a commercial podcast, here's where there would be an advert. But as we're a charity, we don't do that. So instead, we'd like to take this opportunity to tell you about our fantastic resources for people with MS.
Our website, which is mstrust.org.uk, has tons of information and resources for people affected by MS, including lots about relapses. There's a video on how to recognise a relapse and plenty of information on how to manage them too. Head to our A to Z of MS and look under R for relapse. Next, we're chatting to Simon from our MS Trust Enquiry Line.
So I am here with Simon from our Enquiry Line, and I'm guessing we get quite a lot of questions with regards to relapses. One of the questions which we've already tried to answer a little bit in the podcast already is, what is a relapse? What is our definition of a relapse?
A relapse is where symptoms will suddenly increase. New or existing symptoms will suddenly increase quite sharply over a couple of days, will plateau for a bit, and then will start to sort of gradually recover after that. The definition of a relapse says that the symptoms must last for at least 24 hours and occur at least 30 days after a previous relapse and have no other explanation. There are other things that can cause these symptoms. That can be quite a difficult thing to spot, both for the person with MS and for health professionals, which can be a challenge, sort of unpicking whether something actually is a relapse or something else isn't always straightforward, and it is something that we do get questions about.
Yeah.
The thing about other explanations for symptoms is quite important thing, because there are a number of factors that can create relapse-like symptoms, sometimes referred to as a pseudo-relapse, perhaps, which feels a little bit dismissive. But if you have an infection, if you're living through a period of particular stress or anxiety, changes in temperature, if there's a period of hot weather, that can affect symptoms. For some people, cold weather as well. All of these can make symptoms feel worse and feel like they've increased. And for the person living with it, it may feel like a relapse, but in clinical terms, it's not a relapse. And as those trigger factors pass, as the infection goes away or the temperature cools down again, the symptoms will tend to calm down. In clinical terms, a relapse is a patch of inflammation on the brain or the spine as the immune system starts attacking the myelin.
If you're not sure if you're having a flare-up of symptoms or a relapse, how can you sort of figure out what's going on?
I think that's very difficult for the person with MS. I mean, what you're experiencing is a sudden increase in symptoms, and you're sort of less concerned whether that's caused by an infection or by something that's happening in your brain. It would need to be sort of assessed by your health team, your MS nurse and neurologist to understand what is the cause. They'd look into the various things that might be adding to it. If you had an MRI scan at that stage, it could show if there was inflammation that was happening, but that's obviously not always possible. And the terminology around it is sometimes a bit confusing. People talk about relapses and flare-ups and exacerbations and episodes or spikes or whatever. And in some instances, they're referring to a relapse. In some instances, they're talking to an increase in symptoms, which is not a relapse. And so when one person talks about having had a flare-up, it might be something different to what somebody else is talking about.
So much like everything with MS, it's as clear as mud.
There is an awful lot of mud in MS. That's definitely true.
So if it is definitely a relapse, what's some of the most common causes of relapses?
The cause of the relapse is inflammation happening in the brain and spine. External factors, it's harder to pin down. I mean, in some instances, if you've been going through a particularly stressful period, that can sometimes trigger a relapse, or certainly relapses can happen at that stage, which might be associated with that. Some bad infections equally, but on the whole, sort of relapses come out of the blue, and it is a biological thing that's happening within your central nervous system that is the cause of it.
And I guess a lot of people talk about how can we prevent relapses, and I guess taking DMDs and looking after yourself is part of that. But if it's not always preventable, obviously, and if you have a relapse, what can you do if you feel you have one coming on?
I think the best thing to do is talk to your MS nurse or get in touch with your MS team. As you say, they can assess what's happening, if there are other factors that might be making the symptoms worse, or if it is actually a full relapse that's happening. If it is a relapse, they might consider treating you with steroids at that stage, which can help you get through the relapse a little bit quicker. And also they can help you find ways to manage whatever symptoms you're experiencing at that time. There's no set relapse symptoms, and it just depends on where that patch of inflammation has happened and what functions that is affected. But talking to your MS nurse, to your MS team, they can help you find ways to manage whatever symptoms it is that you're experiencing. And those symptoms can be sort of debilitating. You can go from being sort of kind of superficially fit and healthy one day to being to needing a wheelchair or struggling to get out of bed and having suddenly sort of quite complex symptoms to deal with, which will start to recover as the relapse passes, but you will still need help to sort of deal with what's going on whilst you're in the midst of the relapse.
Yeah, and obviously relapses are very different from person to person. I mean, you do hear about people who have to go and stay in hospital, but you can hear, I mean, I feel when we read a lot about MS, I guess you can sometimes prepare yourself for things like, oh, optic neuritis, and you can recognize some symptoms and things like that. But it's because MS has got so many different symptoms, you can't really, there's no way that you can guess what's going to happen to you, is there?
No. I mean, it's kind of like battleships. It's where that patch of inflammation, what that patch of inflammation bumps into. You can't tell. I mean, it could be in one place and there are no symptoms at all because that's part of the brain that doesn't control function. It can be a couple of millimeters to the left or right and your leg doesn't work, or your eye doesn't work, and it's there is so much variety. As I say, there is no set of relapse symptoms, so you can't think I've got this and this, therefore this is a relapse. It's pot luck or pot bad luck, perhaps.
Yeah, no, I think the last two relapses I had optic neuritis, which was fairly clear cut that was a relapse because it was so sort of noticeable what was going on. But then after that, I ended up with the Hermit's sign, the barber chair thing, where and I had read about it so many times, what it, the electrical shocks and things, and I did not understand that was what was happening to me, because for me it felt more like I was slightly sleeping and falling off a bicycle, so I was just jerking up and I didn't understand what was going on. And it wasn't until sort of I spoke to a neurologist that he said, well, that's what you're having. And I felt quite stupid because I'd read about it so many times, but I sort of still didn't understand that was a new thing that was happening. So
yes. The lived experience of a symptom is not the same as reading about it.
No.
I'm very sure. Yeah.
So obviously you're saying there's no set list of these things. I mean, is there any sort of statistics that can say how often people with relapsing or remitting MS can sort of expect to have relapses?
That's very difficult because, of course, nobody with MS is average, and some people may go many years in between relapses, and the relapses when they happen might be sort of pretty mild. Other people may experience several relapses in a year, and have a much more aggressive course of MS. I think the important thing is that every relapse is important. Every relapse is an indicator of MS disease activity, and it's useful to talk to your MS team about it and make them aware of it, just so that they can assess what you need to do to get through what you're experiencing at the time. Even if the relapse feels relatively mild, is not having a major impact on a lot of things you do, it is indicating that something's happening. And also it has a sort of longer term role of sort of understanding what your MS is doing. Is the current treatment that you're receiving working? Does it need reviewing? Should you be moved on to something else that can dampen down the activity that's causing the relapses?
And if you're having sort of more relapses, I mean, if you're on treatment, but is there a sort of certain amount of relapses that you should start to get worried about or concerned that this is maybe, things are maybe not working out?
I would say that one really is worth talking about, even if when you talk with the MS team about what's going on, they decide that the treatment is okay. This relapse has managed to break through, but on the whole, the treatment is working okay. Having that conversation, I think, is important, rather than sort of battling through and not telling people about it, because it may be that the treatment isn't doing what was expected, and something more powerful might be necessary to try and get on top of the relapses, because every relapse carries the risk of creating more a build up in disability, and build up in symptoms. So as much as it's possible, try and find ways to reduce the risk of the next relapse after the one that you're in, and part of doing that is letting your MS team know about the relapse that you're in.
And we quite often talk about keeping symptom diaries and things like that. I guess it's always good to sort of note down what's going on with you.
Yes, I mean that's certainly true. I mean, MS is a a long-term condition. It doesn't happen in single events, and even if it's not as dramatic an event as a relapse, there will be day-to-day sort of fluctuations in symptoms, good days and bad days, and sort of knowing that, having that picture, having that long-term picture to review can be helpful in spotting things that might help, and things that might be building up as well. So whether that's medical things or whether it's changes that you can make in what you do, or other lifestyle factors, that might give you indicators of things that might make things a little bit easier.
Obviously, some people, and I guess this could be more for the newly diagnosed, but people who live with MS for a while, people sort of live a little bit in fear of having a relapse, because, you know, especially when you're new to MS and you join forums or what have you, and you hear other people and you don't know sort of what's going to happen. How can you deal with the anxiety of sort of not knowing what's going to happen when it comes to relapses?
It's a quite understandable anxiety. I mean, MS is, if anything, MS is unpredictable, and you never know when a relapse is going to, if you've got relapsing MS, you never know when a relapse is going to happen. You never know what that relapse is going to do to you, how much you're going to recover from it, and what the lasting effects of it, which it's quite natural that causes a degree of anxiety. It's helpful if you can find ways to manage that anxiety. I mean, on a basic level, so it's just sort of trying not to dwell on something that hasn't happened yet can be helpful. That's easily said and not possible for everybody. I'm staying social, sort of talking to other people, and not just other people with MS, about sort of what's happening in their lives and their concerns, and sort of getting your own situation in perspective, and talking about your anxieties with other people can be helpful to spread them out and make them thinner, perhaps. If the anxiety is getting in the way, I mean, if anxiety is stopping you doing things day to day, then do talk to your GP or to your MS nurse about it, and there may be things that can be done to help manage it on a more formal level, with CBT perhaps, or mindfulness, things that allow you to explore what you're going through and learn ways to manage that anxiety, not necessarily to sort of eliminate it, but sort of to manage it and stop it becoming a problem in its own right.
We already spoke about talking to you, keeping your MS team informed about what's going on with relapses, but is there anyone else? Are there other people that you should tell about if you're having a relapse?
Given that a relapse will potentially stop you doing things in your life, it's helpful to let friends and family know that's pre-warn them really that it's a potential thing, and if you're in a relapse and you find that some of the things you can't do let them know if they can help you on whatever level that is, whether it's sort of, you know, childcare or just sort of getting shopping or whatever, and just calling on that support and letting them know that that this is happening. If you work, obviously sort of letting your employers know that this is the case. If you have MS, you're covered by the Equality Act, which means that your employer has to make reasonable adjustments to accommodate for your MS, and giving you flexibility whilst you're having a relapse and recovering from a relapse would certainly fall into that. They can't discriminate against you because of your MS, and the fact that the relapse has altered what you can do, and hopefully they will sort of be reasonable about sort of, you know, helping you sort of return to work when you're able to, possibly with a phased return, or sort of taking things easy when you first get back and getting back into the swing of things again.
Speaking of time and how long it can take to sort of get back into it, is there a sort of an average times about for how long a relapse normally lasts? I mean, it depends on the symptoms, doesn't it? But
again, it's one of these unknowns. As we say, the definition is lasting more than 24 hours, but in most cases, it's going to be a matter of weeks, and for some people, it can be months. Some relapses can have a long tailed, which again very much depends on the symptoms and how quickly things calm down and you get to a stage where you can manage after the effects of a relapse. You can't put a date in your calendar that I've got a relapse now, but it'll be over by then.
No, it doesn't really work like that, sadly. How common is it to sort of not fully recover from a relapse?
Again, it's hard to put a figure on it. Certainly earlier in somebody's MS, there's a better chance that as you come out of the relapse, you'll go back to your previous baseline, to the previous level of symptoms before the relapse happened. In effect, the relapse fully goes away in that case. But over time, there's a higher chance that there will be something left behind after the relapse. The symptoms won't go all the way back to where they were. You will be left with some degree of symptoms of the relapse after it's passed. What that level will be, of course, you won't know until you get to that point, really. It's again an unknown.
Yeah, it's a tricky one. I mean, we've mostly been talking about relapsing remitting MS here, but can you still have relapses if you have progressive MS?
Yes, less frequently, but they can happen. And secondary progressive, of course, following on from relapsing MS, the transition period between relapsing and secondary progressive MS, it is not a sudden cutoff, and the relapsing element is overlapping with the progressive element as you move into secondary progressive MS. So there will be relapses at that point. They will become less frequent and become a smaller part of the MS, but they still can happen. In progressive MS, relapses are less usual, but they're not unknown. They can happen, even though the defining feature in progressive MS is more about the loss of nerves and the loss of nerve fibers in the brain and spine. There is still a degree of inflammation that happens, and that can cause the occasional relapse. In North America, they sometimes use the phrase progressive relapsing MS for people with progressive MS who have relapses. That phrase has tended not to be used in the UK, and it's all been seen as part of primary progressive MS, or perhaps in more recent terminology, active primary progressive MS. So, and if a relapse happens in progressive MS, it's treated in the same way as in relapsing MS with steroids and that approach if necessary. But so they can happen. They're less frequent, but they're not unknown.
When people are being diagnosed with either sort of relapsing remitting MS or secondary progressive or primary progressive MS, is there any sort of counting that goes into relapses or what in the diagnosis procedure?
There's not a kind of cutoff. You've had this many relapses, therefore. Relapses are an indicator of disease activity. So, but there are other things that they'd be looking for in diagnosis. Well, to diagnose MS, what they're looking for is what they call dissemination in space, which means that there's patches of damage happening in the brain and spine in different points of the brain and spine, and also dissemination in time, so that those patches of damage are happening. There are different episodes of damage that are happening. These things can be seen through MRI scans and lumbar punctures, and there are tests that sort of demonstrate where these things are happening. Not all of the patches of damage will cause symptoms, and they'll be in areas of the brain that don't affect function, or the brain can, particularly early on, can sort of divert messages around an area of damage, so that they won't necessarily be visible as symptoms or particularly pronounced symptoms. often a relapse will be the thing that pushes somebody to seek a diagnosis in the first place, because suddenly symptoms have been thrust into the foreground. And if somebody is having symptoms, having relapses, that is a useful piece of evidence for the neurologist, but it's not a number of relapses that they're looking for.
Yeah, no, that makes sense. Well, this has been super useful. I'd like to sort of just a final question, which we have already touched a little bit about, but if somebody is having a relapse, what's the sort of the best way that they can look after themselves?
Medically, they might consider, or the MS team might consider using steroids. If steroids are used particularly early in the relapse, steroids are anti-inflammatories, so they can calm down what's causing the relapse. Steroids don't have an effect on the long-term course of your MS, but they do get you through the relapse a little bit quicker, or they can get you through the relapse a little bit quicker. So whether you take steroids or not, you will end up at the same point at the end of the relapse. It's just that if you take the steroids, you'll get there a week or two sooner than if you don't. But equally, if you don't take steroids, then you won't do yourself any long-term harm. The relapse will last a little bit longer, but you will not end up any worse off than you would have done had you taken them. And there are issues with side effects with steroids if you have too many courses of them in a short period of time. So if you're having several relapses in a year, your MS team will probably limit the number of times you have steroids, so you don't get to that threshold where the side effects are becoming a problem. Outside of the medical approach, I think the approach to sort of managing a relapse is not being too hard on yourself. You will suddenly your symptoms will suddenly have become a lot worse, which will be frightening. You might be anxious, you might be hugely frustrated that you now can't do things that just a few days before were fine, and all of these sort of negative emotions are entirely sort of understandable in that situation, but try not to be too hard on yourself. This is something that happens in MS, and it's happening to you, so don't beat yourself up about the fact you've got a relapse. Sort of be aware of what's happening to you, sort of take sort of sensible precautions so that you're not putting yourself at risk by trying to do things that you're not able to do. If possible, call on friends and family to help you out. Don't try and think that you have to do everything, or if you don't have anybody to turn to, sort of do consider what you need to do and what you don't need to do, and don't push yourself too hard at a time when your abilities have been limited by the relapse. And as we said earlier, sort of let the right people know, so that people know not to call on you to do things that you're not able to at this stage. So it's all kind of look after yourself, do the general sort of lifestyle sort of things, try and stay as active as the situation allows, given that the level of activity is likely to be much smaller. Do continue to eat healthily. Try not to get too stressed about the situation, and and so see how things sort of develop over time, and with the help of your MS team, sort of kind of ride out the relapse and wait for things to recover.
That sounds like sound plan. And if people have any questions when it comes to relapses or anything about MS, we're always happy to talk to them on the inquiry line, aren't we?
Yes, certainly. The inquiry service is here 9 to 5, Monday to Friday, and equally we've got good information on the website as well, and also a small sort of concertina card publication about relapses that's free, that people can order from the website. So there is information out there to help you understand what's going on and help you get through it.
Thank you so much, Simon, for chatting with us.
That's okay.
And we're back. Lots to learn about relapses today. It's kind of what we were discussing, me and Simon. It's not really, it's clear as mud. people don't really, I think it's hard to know if you're having a relapse or if you're not having a relapse, and especially if you're newly diagnosed with MS. I mean, it's been quite funny recovering this subject this week, because I'm going through a bit of a pseudo relapse at the moment because of having this cold, which you might have heard that I got one. And my son got a cold last week, and sort of managed to get that myself. And as Miranda and Simon were talking about, that infections can trigger off MS symptoms, existing MS symptoms, and it's hard to know whether things could be a relapse or not. So I've struggled a lot with vertigo this week, which is something that happens when I sometimes get colds. The first time I got vertigo, it was sort of a part of a proper relapse, and it came out of nowhere. I didn't have a cold or anything like that. But the first time that vertigo showed up with a cold, I was very confused what was going on. Now I'm sort of quite a few years into my MS journey, and I can sort of spot it now when it's coming. But yeah, it's hard, and it's not always clear what is a relapse and what's not. But I think it's one of the things that's important to know, that even if it isn't a relapse and it's just symptoms that are flaring up, it still can feel quite overwhelming and hard work, and you still need to treat the symptoms. However you treat them, where you probably wouldn't go about getting steroids for them, but like I've had to take some medication for my vertigo this week. But yeah, you get weird things. Like I had shingles this summer, and I got a quite high temperature from that, and my MS symptoms got weird again. So yeah, it's not always. It's a strange thing, MS.
Yeah, I know when we did the Ask Me Anything on Instagram recently about relapses, one of the most common questions was, how do I tell sort of the difference between a relapse and perhaps a flare-up, or just symptoms playing up from time to time? Because I think that's one of the things people really do want to know, and it can be really tricky to sort of pinpoint.
Yeah, and I mean, I think it for me, it's just come with time, having had MS for quite a few years now, being able to sort of pinpoint what's the different thing. But I think even if your MS nurse would say, well, actually, you're not having a relapse, it's just because you have an infection, it's still it can still feel quite overwhelming and horrible, because you're still not feeling great. Just because somebody's telling you don't have a relapse, it doesn't mean that you're suddenly like, whoa, well, it's all good then. But I think, it's always good to talk to your MS team about these things. Like I did email my nurse when I had the shingles, and I suddenly started feeling really funny, because it sort of just keeps it. It's good to keep some sort of symptom diary and to know what's going on with your MS anyway. And but definitely, if you're having a relapse, it's good to let your MS team know what's going on. And I mean, there's things like the weather as well, because at the moment we got quite cold weather, and sometimes that kind of makes your symptoms flare up as well. So it's not always just having an infection of any kind. So, but it's always good to be alert.
So speaking of weather, our next podcast is going to be about MS and temperature sensitivity, with a focus on the cold weather. As you may have noticed, we're in December now. I don't know quite how that happened, but here we are. And we'd really love your input on this new podcast. So whether you've got sort of a tip about how you deal with the cold, or how your MS symptoms are affected by it, we'd love to hear from you. So please leave us a voice note on our new service. We've got a WhatsApp. So if you just drop us a message or a voice note on 0745 830 3326, and we might even include yours in the podcast.
Yes, please do leave us messages. We're quite excited about having this set up, because we would love to hear some more voices on this podcast. But just a quick note, though, we can't answer questions via on WhatsApp. The account is sort of just monitored for the voice notes and contributions to this podcast.
Even though we can't answer questions via WhatsApp, there are still places you can get in touch with us if you have any questions. So remember that our Inquiry service is available from Monday to Friday, except UK bank holidays. That's from 9 a.m. to 5 p.m. And outside of those hours, you're welcome to leave us a message and we'll get back to you as soon as we can. So the number for our inquiry service is 0800 032 3839, or you can email us on ask@mstrust.org.uk.
And you can also find us on the socials, Facebook, YouTube, Twitter, and Instagram. And you can find this podcast on Spotify, Google, Apple Podcast, and Amazon Music. Get in touch, and like they say, like and subscribe. Tell people about this podcast. We'd love to reach some more people. And we also like to say a big thank you, as always, to Anne Chapman Audio for the music of this podcast.